Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear a dermatologist talking to a patient called Mark Jackson. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good afternoon, Mr. Jackson. I'm Dr. Peters. Nice to meet you.
Hi, nice to meet you too, Doctor.
So, let's get started by discussing the reason for your visit. Could you tell me in your own words what brought you here today?
Sure. It's been an ongoing issue for a while now, maybe for the past year or so. My scalp has been really flaky and itchy. At first, I thought it was just dry skin or something, but it's gotten worse. No matter what I try, it doesn't seem to go away.
I see. When you say it's gotten worse, can you describe how the symptoms have changed over time?
Well, in the beginning, it was just a bit of flaking, but over the last few months, it's become more intense. Now, I'm constantly scratching my scalp because it itches so much, and every time I run my hand through my hair, I see flakes falling. It's embarrassing, especially when I'm at work or out with friends.
That must be frustrating. Have you noticed anything else, like redness on your scalp, or any areas where the skin looks irritated?
Yes, actually. I've noticed some redness, especially around the hairline and on the back of my head. Sometimes the skin feels kind of sore, like it's irritated from all the scratching. I've tried switching shampoos and even used some over-the-counter treatments, but nothing has really helped.
That's a common experience. Dandruff can sometimes be persistent, even with over-the-counter products. Did you notice if certain shampoos made things better or worse?
Not really. I've tried a few anti-dandruff shampoos and they might help for a few days, but the flakes always come back. Some shampoos even made my scalp feel more dry and irritated, which I wasn't expecting.
It sounds like your scalp may be reacting to certain ingredients. Dandruff can be tricky because it's often not just about dryness. It's usually a mild form of seborrheic dermatitis, which is a condition caused by excess oil production and a type of yeast that naturally lives on the scalp. When the yeast overgrows, it can cause flaking, irritation, and redness.
I didn't know that. I always thought dandruff was just from having a dry scalp.
That's a common misconception. While dry skin can cause flaking, dandruff is usually more related to oiliness and the yeast I mentioned. The good news is that there are targeted treatments we can use that go beyond regular dandruff shampoos.
So, what do you recommend? I'm really hoping to get this under control because it's starting to affect my confidence.
Absolutely, I understand. Since the over-the-counter shampoos haven't been working for you, we'll likely need to try a medicated shampoo that contains active ingredients like ketoconazole or selenium sulfide. These ingredients help reduce the yeast on the scalp and control the flaking. I might also prescribe a topical corticosteroid if the redness and irritation are severe to calm the inflammation.
That sounds promising. How often would I need to use the medicated shampoo?
Typically, you'd use it 2 to 3 times a week, depending on how severe your symptoms are. You'd leave the shampoo on your scalp for about 5 minutes before rinsing it out, to to give the medication time to work. On other days, you can use a gentle, non-medicated shampoo that won't irritate your scalp.
Okay, I can do that. How long before I start to see results?
Most people start to see improvement within a few weeks of regular use, but it's important to keep using the treatment even after the symptoms improve. Dandruff tends to be a chronic condition, so it's about managing it over time rather than curing it completely.
Right, that makes sense. I'll stick with it. Is there anything else I should be doing in the meantime, like changes to my diet or lifestyle?
Diet and lifestyle changes can help to a degree, especially if you're noticing flare-ups due to stress, or if you're using hair products that might be too harsh. Try to avoid heavily fragranced shampoos or styling products, as they can irritate your scalp. It's also a good idea to minimize stress, as stress can sometimes worsen skin conditions like dandruff.
I didn't realize stress could make dandruff worse. I've been under a lot of pressure at work recently, so that might be part of it.
It's definitely possible. Stress can disrupt the balance of oils and the immune response in your skin, which may trigger a flare-up. It's always good to manage stress where you can, whether it's through exercise, relaxation techniques, or finding other ways to decompress.
I'll try to keep that in mind. It's just been frustrating not being able to control this on my own.
I understand. Dandruff can be tough to manage without the right treatments, but with the medicated shampoo and a few lifestyle adjustments, we should be able to get it under control. It's all about consistency.
I'm really glad I came in. I feel like I finally have a plan.
That's great to hear. We'll follow up in about 6 weeks to see how you're responding to the treatment. If the symptoms are still persistent, we can explore other options, like different medications or even light therapy in more stubborn cases.
Light therapy? I didn't realize that was an option for dandruff.
Yes, in some cases, phototherapy can help reduce the inflammation associated with seborrheic dermatitis. But let's see how you respond to the shampoo first before we explore that route.
Extract 2, questions 13 to 24. You hear a doctor talking to a patient called Mrs. Wilson. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good afternoon, Mrs. Wilson. How can I help you today?
Afternoon, Doctor. I'm a bit worried about a mole I've noticed on my shoulder. It's changed recently, and I'm not sure if it's something I should be concerned about.
I see. Let's talk about it. When did you first notice the mole, and what kind of changes have you observed?
Well, I've had the mole for years. It used to be just a small, flat brown spot, but over the last couple of months it's become darker, raised and bigger. It's also started to itch sometimes. My husband thinks it looks different too, which is why I thought I should come in.
It's definitely good that you came in, especially since you've noticed changes. Moles can change for a variety of reasons, but we do want to rule out anything more serious, such as melanoma, which is a type of skin cancer. Have you noticed any other symptoms, like bleeding, crusting, or a change in the borders of the mole?
Now that you mention it, the edges of the mole look kind of irregular. They used to be smooth, but now they're jagged. It hasn't bled or anything like that, but it feels a bit different to the touch, almost like it's thicker.
Those are important details. The changes in size, color, shape, and texture that you've mentioned could potentially indicate melanoma. But before we jump to conclusions, let me take a closer look at the mole and examine it properly. After that, we may need to run some tests to be sure. How long has it been since you noticed the itching and the changes in the mole?
I'd say it started about 3 months ago. At first, I didn't think much of it because I have a lot of moles, and none of them have ever caused me any trouble. But then it started getting bigger and darker, so I figured I should get it checked out.
You made the right call coming in. Melanoma, if caught early, can often be treated successfully, so it's always better to be cautious. Let's talk a bit about your sun exposure. Have you spent a lot of time in the sun or had any significant sunburns in the past?
Oh, yes. I grew up in Australia, so I spent a lot of time in the sun as a kid. We never really used sunscreen back then. I did get some pretty bad sunburns when I was younger, but nowadays I'm more careful. I wear sunscreen if I'm outside for a while and try to stay in the shade when I can.
That background of significant sun exposure and sunburns does increase the risk for melanoma. Melanoma is primarily caused by ultraviolet UV light from the sun, so people with a history of sunburn or prolonged sun exposure are at higher risk. But let's not get ahead of ourselves. There are different types of skin cancers, and not all moles that change lead to melanoma. I'll have a good look today and might suggest further investigation depending on what I see.
Okay. Should I be checking my other moles as well?
Yes, it's a good habit to regularly check your moles, especially if you have a lot of them. I recommend using what we call the ABCDE rule to monitor changes. A stands for asymmetry, if one half of the mole looks different from the other. B is for border, irregular or jagged edges, like you mentioned. C is for color, if there are multiple colors or the mole is getting darker. D stands for diameter. Any mole larger than a pencil eraser is worth keeping an eye on. And E is for evolving, if the mole changes over time in size, shape, or sensation. It sounds like your mole ticks a few of those boxes, so I'll make sure to check it thoroughly.
That's helpful, thanks. Is melanoma hereditary? I ask because my mother had skin cancer, but I don't think it was melanoma.
Skin cancer, including melanoma, can have a genetic component. If there's a family history of melanoma or other types of skin cancer, it can increase your risk. But sun exposure is still the primary cause. Even if your mother had a different form of skin cancer, it's worth being vigilant. We'll check the mole today, and if needed, I can refer you to a dermatologist for further testing or a biopsy.
I'm starting to get a bit nervous now. What happens if it turns out to be melanoma?
It's understandable to feel anxious, but try not to worry too much just yet. If it's melanoma, treatment depends on how early we catch it. Early-stage melanoma is usually treated with surgery to remove the mole and a small area of the surrounding skin. This is often enough to prevent it from spreading. If it's more advanced, additional treatments like immunotherapy, radiation, or targeted therapy may be recommended. But remember, early detection gives the best chance for successful treatment, so you've done the right thing by coming in early.
That's reassuring. So, what should I expect next?
First, I'll examine the mole, and if it looks concerning, I'll refer you for a biopsy. The biopsy involves taking a small sample of the mole tissue, which will be sent to the lab to determine if it's melanoma. The results usually come back in a week or two. If the biopsy confirms melanoma, we'll move forward with treatment right away.
Thank you, Doctor. I feel better knowing we're going to get this checked out.
You're welcome, Mrs. Wilson. Let's take care of it.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear 2 colleagues talking about an article. Now read the question.
Did you read that article on the impact of visual impairments after a stroke in the recent Medical Rehabilitation Journal?
Yeah, it was surprising to see how often these issues are overlooked.
I know. A lot of stroke survivors don't even realize their vision is affected, which is why these impairments often go unnoticed.
Right, And the article stressed how important it is for healthcare professionals to understand the impact of these invisible visual impairments on daily life.
Absolutely, because patients are struggling with things like reading, driving, or even walking without knowing that their vision might be to blame.
Yes, and if we can raise awareness, more patients can get the help they need sooner.
I think that's the key takeaway from the article. It really pushes for more routine assessments to identify visual issues post-stroke.
Agreed, and it makes a compelling argument for better rehabilitation programs to address these impairments more effectively.
Now look at question 26. You hear a healthcare consultant giving a presentation about a study. Now read the question.
Study involving 3 hospitals and 5 outpatient clinics where we implemented several interventions aimed at reducing medical errors, controlling infections, and promoting evidence-based practices. These interventions included improving hand hygiene compliance, medication error reporting systems, and the use of clinical guidelines based on the latest research. What we found was that all sites showed a significant reduction in medical errors and infection rates over a 6-month period. However, one clinic did not see much improvement, and this was likely due to inconsistent adherence to the interventions. This study highlights the potential for these strategies to be applied more widely, especially in smaller clinics where resources might be more limited, to further improve safety and care quality.
Now look at question 27. You hear a nutritionist speaking to a woman. Now read the question.
So, we've discussed the potential impact of your husband's current diet and exercise routine. Often, a combination of unhealthy eating habits and limited physical activity can contribute to health problems over time.
So if he changes his diet and starts exercising more, could we expect to see some improvements fairly quickly?
Possibly. Every individual responds differently, but adopting healthier eating habits and a more active lifestyle could bring noticeable improvements within a few weeks.
Well, that's reassuring. But at least he's not facing any major health issues just yet, right?
According to the assessment, his current condition isn't critical, but his cholesterol levels are high, and he's at risk of developing more serious problems if these lifestyle factors aren't addressed soon.
Now look at question 28. You hear a trainee doctor asking his senior colleague about tapeworm infection. Now read the question.
I saw Mr. Lee's test results and it shows he has a 20-foot-long tapeworm. He's mentioned that he frequently consumes undercooked beef, and I was wondering if that could be the cause. Should we assume that's how he got the infection?
Yes, it's highly probable. Tapeworms, particularly Tinea saginata, are commonly transmitted through the consumption of undercooked or raw beef. The larvae can survive in contaminated meat, and once ingested, they can develop into full-size tapeworms in the intestines. In Mr. Lee's case, he could have been harboring it for quite some time, as these parasites can go unnoticed for years. So his eating habits are definitely a key factor here. Of course, we should also explore any other potential sources of infection just to be thorough.
Got it, that makes sense.
Now look at question 29. You hear a trainee doctor explaining about an activity. Now read the question.
So, what's this new activity we're doing today?
It's called case-based debates. We're divided into teams, and each team is given a medical case to review. Then we have to present our case and debate the best treatment options.
Oh, I see. So, what's the goal of the game?
Well, the idea is to clarify complex medical issues by discussing them in a competitive format. Each team argues for their approach, and we compare it with the other team's strategies.
Sounds interesting. Do we get feedback?
Yes, the facilitator provides feedback after each debate, helping us understand different perspectives and reinforcing key medical concepts.
Great. Let's get started then.
Now look at question 30. You hear two managers discussing about the workshop. Now read the question.
Among healthcare staff has been quite low, hasn't it?
It has, but I'm not exactly sure why. Everyone seems aware of its importance. We even had the session split into 2 one-hour slots to make it easier for doctors and nurses to attend between their duties. But apparently it wasn't feasible because the material needs to be covered in a specific format.
Yeah, I don't think the timing was the issue anyway. Once staff understand how crucial time management is to improving patient care and avoiding burnout, we might see more engagement.
Definitely. There's a clear need for it, even though staff might not fully realize how important it is right now.
That is the end of part B. Now look at part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear a Dr. Caroline Hayes giving a detailed presentation on eating disorders. You now have 90 seconds to read questions.
Good afternoon, everyone. I'm Dr. Caroline Hayes, and today I'll be addressing a topic that often goes unspoken: eating disorders. Eating disorders are complex mental health conditions characterized by unhealthy eating habits and severe concern with body weight or shape. They affect millions of people worldwide, including men, women, and children, yet they remain highly stigmatized and misunderstood. The most common types include anorexia nervosa, bulimia nervosa, and binge eating disorder. But there are many variations, each with its own unique challenges. Despite growing awareness, eating disorders continue to be a significant public health issue. These disorders can lead to severe physical and psychological complications, including malnutrition, cardiovascular problems, and increased risk of depression and anxiety. The treatment and management of eating disorders are challenging, not only because of the deeply rooted psychological factors involved, but also because of the reluctance of individuals to seek help due to fear of judgment or misunderstanding. As a result, many patients suffer in silence for years, often enduring a dangerous cycle of disordered eating behaviors without receiving the care they need. One major challenge in the management of eating disorders is the delay in diagnosis. Eating disorders frequently go undetected for extended periods, especially in individuals who do not fit the stereotypical image of a person with an eating disorder. Healthcare providers often miss the signs, focusing instead on more visible physical health issues, or dismissing symptoms as a phase, particularly in teenagers. This raises important questions such as, why are eating disorders often missed in initial assessments, and what can be done to improve early detection? It's crucial that healthcare professionals become more vigilant in recognizing the warning signs and understand that eating disorders affect people of all body types and backgrounds. Recent research has highlighted the critical importance of early intervention. A study published in The Lancet Psychiatry found that patients who received treatment within the first 3 years of developing an eating disorder had significantly better outcomes compared to those who sought help later. The study reviewed over 1,000 cases and showed that early intervention not only improved recovery rates, but also reduced the risk of long-term complications, such as osteoporosis, infertility, and chronic digestive issues. Despite these findings, many patients still face barriers to accessing timely care, including limited resources, lack of specialized treatment centers, and long waiting lists. Treatment for eating disorders is multifaceted, often involving a combination of psychological therapy, nutritional counseling, and medical monitoring. Cognitive behavioral therapy (CBT) remains the most widely used approach, helping patients identify and change distorted thought patterns related to food, body image, and self-worth. However, the effectiveness of treatment can be hindered by the patient's fear of gaining weight or a strong denial of their condition. Even with professional support, relapse rates are high, making ongoing support and long-term follow-up essential components of care. One aspect that is frequently overlooked in the treatment of eating disorders is the impact on families. The burden of caring for a loved one with an eating disorder can be overwhelming, leading to increased stress, anxiety, and even depression among family members. Families often struggle with feelings of helplessness, guilt, and frustration as they navigate the complexities of supporting someone who may resist treatment. This highlights the need for family-based interventions that provide education, support, and coping strategies to those closely involved in the patient's care. An additional complication is the influence of social media and societal pressures, which play a significant role in the development and perpetuation of eating disorders. Unrealistic beauty standards, the glorification of extreme diets, and the constant comparison with others contribute to the distorted body image that often underlies these conditions. While not the sole cause, these factors can exacerbate existing vulnerabilities, particularly among adolescents and young adults who are highly susceptible to external validation and criticism. Healthcare professionals must also be aware of the physiological impact of eating disorders. For instance, anorexia nervosa has the highest mortality rate of any mental health disorder, largely due to the severe medical complications associated with starvation and malnutrition. On the other hand, bulimia nervosa can lead to electrolyte imbalances, heart issues, and gastrointestinal damage, often exacerbated by the repetitive cycle of binging and purging. Binge eating disorder, which is the most common eating disorder in the United States, increases the risk of obesity, type 2 diabetes, and hypertension. This underscores the need for comprehensive care that addresses not only the psychological but also the medical aspects of these conditions. In closing, eating disorders are complex, multifaceted conditions that require a comprehensive, compassionate approach to care. Early diagnosis, appropriate treatment, and ongoing support are key to improving outcomes for those affected. It is also essential to educate healthcare providers, families, and society at large to reduce stigma and promote understanding. By doing so, we can encourage more individuals to seek help without fear of judgment and ultimately improve the lives of those battling these challenging disorders.
Extract 2. Questions 37 to 42. You hear a conversation between a journalist and Mr. Carlos Lopez discussing bioelectronic medicine. Now, read the questions. You now have 90 seconds to read questions. Today, we are talking with Mr. Carlos Lopez, a neuroscientist with a keen focus on bioelectronic medicine. Mr. Lopez, could you explain what bioelectronic medicine is and how it actually works?
Certainly. Bioelectronic medicine is a rapidly advancing field that integrates biology, neuroscience, and engineering to create devices that can interact with the body's nervous system. These devices, often implanted in specific areas of the body, work by altering electrical signals between nerves. The aim is to help treat a wide range of conditions, such as persistent pain, autoimmune disorders, and even mental health conditions like anxiety or depression. For example, in chronic inflammatory conditions, there are faulty neural signals that perpetuate the body's immune response. These bioelectronic devices can intercept and correct those signals, leading to a reduction in inflammation without relying on pharmaceuticals. The potential is extraordinary because we're treating the root causes of many diseases by working directly with the body's own communication system rather than relying on medications that might have widespread effects.
That's fascinating. How did you get involved in this field?
My journey started during my early career as a neuroscientist. I was investigating how neural circuits govern bodily functions. And I became deeply interested in the ways electrical signals could be modulated to improve health outcomes. As I delved into this research, I realized that many chronic conditions we currently manage with drugs could potentially be treated by directly targeting nerve signals. Having seen friends and family members struggle with chronic diseases, I was highly motivated to explore bioelectronic medicine as a safer and more effective alternative to traditional therapies.
Can you give an example of where bioelectronic medicine has made a big impact?
One area where bioelectronic medicine has shown a great deal of promise is in managing chronic pain. A case that comes to mind is a patient named David, who had severe neuropathic pain following a spinal cord injury. Despite numerous treatments, including strong painkillers, he found little relief and struggled with the side effects. We implanted a bioelectronic device to regulate the pain signals from his spinal cord to his brain. Within weeks, his pain significantly decreased, and he regained mobility and independence. For many individuals with chronic pain, conventional methods are either insufficient or come with unwanted side effects. Bioelectronic medicine offers an alternative by addressing the neural pathways that transmit pain directly, providing relief without the need for long-term medication.
Are there any challenges or risks with bioelectronic devices?
As with any medical technology, there are inherent risks. The most common issues include the possibility of infection at the implant site or mechanical failure of the device. Additionally, some patients might require periodic adjustments or replacements over time, especially as the technology evolves. However, the risk is generally low, and for many patients, the potential benefits outweigh these concerns. Another challenge is that bioelectronic medicine is not universally applicable to all patients. We need to carefully select individuals who will respond positively based on their specific conditions and medical history. For example, not everyone is an ideal candidate for device implantation, and we must carefully weigh the risks and benefits for each patient.
Do patients express apprehension before opting for this treatment?
Absolutely, especially at first. The idea of having an implant that interacts with your nervous system can be intimidating. One of my patients, Sarah, was initially very skeptical about the whole concept, particularly the idea of introducing foreign hardware into her body. She was concerned about potential long-term effects and whether the device would actually work. But after thoroughly discussing how it might alleviate her chronic pain and allow her to reclaim her life, she decided to proceed with the procedure. Now, she often tells me it's the best choice she's ever made. The key is giving patients all the information they need and addressing their fears honestly.
Finally, what does the future hold for bioelectronic medicine? Are there any upcoming developments that patients should be excited about?
The future is incredibly bright. We're already working on the next generation of devices that are smaller, more precise, and capable of wirelessly communicating with external systems. This means we'll be able to monitor and adjust treatments remotely, making them even more personalized. There's also ongoing research into using bioelectronic devices to treat neurological disorders like epilepsy, Alzheimer's disease, and Parkinson's. The possibilities are vast, and as we continue to better understand how the nervous system functions, we will open up even more opportunities for treatment.
That is the end of Part C. You now have 2 minutes to check your answers.